Assalamualaikum. I'm Dr. Amara from MMK Hub. Today I'm going to give the lecture about the ovarian cyst. And the purpose of giving the lecture is that we can make your concepts more clear. Ovary. Normal size of the ovary is 5 into 3 into 3 centimeters. And if we consider it in millimeters, then it would be 50 into 30 into 30 millimeters. Variation in dimensions can result from different reasons, like if there is endogenous hormonal production, it varies with age and menstrual cycles, as all of us know that hormonal effects on the uterine walls causes the difference in sizes and thickness of the wall of the uterus. Exogenous substances including PCOs and gonadotrophic releasing hormone agonists or ovulation inducing medications may affect the size. These are the exogenous substances. These are those hormones which are synthetic hormones, and they are introduced externally but they can affect the uterine wall and their size. Adnexal masses. Differential diagnosis of the adnexal masses varies considerably with the age of the patient. In premenarche girls and postmenopausal women, adnexal mass should be considered highly abnormal, requires immediate investigation. In menstruating patients, differential diagnosis is varied. Adnexal masses. There is a table showing differential diagnosis of adnexal masses. These can be cystic and can be solid, and their origin is from different adnexal organs, which include ovary, fallopian tubes, uterus, bowel, and miscellaneous. The miscellaneous include distended bladder, pelvic kidney, and urachal cyst. Ovarian cyst symptoms. Benign cyst can cause pain and discomfort related to pressure on adjacent structures, torsion, rupture, and hemorrhage within and outside of the cyst. Morbidity includes menorrhagia, an increased intermenstrual interval, dysmenorrhea, pelvic discomfort, and abdominal distension. Benign cysts rarely cause death. Ovarian cyst, and more specifically corpus luteal cyst, can rupture, causing hemoperitoneum, hypotension, and peritonitis. This can be exacerbated in women with bleeding dyscrasias, such as those with von Willebrand disease and those receiving anticoagulant therapy. Ovarian torsion can complicate ovarian cyst and can result in ovarian infarction, necrosis, infertility, premature ovarian menopause, and preterm labor. Now, how we will diagnose different ovarian cysts? As most common ovarian cysts present with no signs or symptoms, they frequently go undiagnosed. This also makes it difficult to accurately estimate incidence and prevalence of the condition. Sometimes even without symptoms, a cyst may be diagnosed during an unrelated pelvic examination or ultrasound scan. In determining a diagnosis, we need to know about the shape of the cyst, the size of the cyst, and the composition of the cyst. On clinical examination, the character of the cyst of different benign and malignant cysts depends upon the age, laterality, mobility, feel, surface, ascites, growth, nodules. Now, how will we go for the examination? First, in abdominal examination, we will inspect. That is, the first step is the inspection. Bulging of the lower abdomen, and then on palpation, we can feel the cystic and tense cystic lesion percussion there is dull in the center, resonant in the flanks, and there can be fluid thrill, that is positive fluid thrill. On auscultation, there can be positive friction rub. On bimanual pelvic examination, uterus separated from the mass, groove present between uterus and the mass, movement of mass per abdominal, fails to move cervix, lower pole of the cyst felt through fornix, absence of pulsation of uterine vessels through fornix. Thank you so much. That's all for the today's lecture. And if you have any queries, you can contact us on the website and WhatsApp group of MMK Hub.